guys! Welcome to Kapitids. Today, we're going to discuss about a condition called Bell's palsy. Before we start, how are you feeling? Can you make a face? Oh, it feels that you're excited on our lecture today. So am I. So let's start.
Our objectives. First, students will be able to define and understand about the given condition. Second, students will be able to identify the related anatomy and physiology of the condition. Third, students will be able to understand how the condition occurs, the signs and symptoms of a person with Bell's palsy. Fourth, students will be able to distinguish Bell's palsy from other conditions that are similar. Fifth, students will be able to identify the different complications of Bell's palsy. Sixth, students will be able to know the different medical assessments and treatment for Bell's palsy. And last, students will be able to know other factual contents related to Bell's palsy.
So Bell's palsy is defined as idiopathic cranial nerve 7 paresis or paralysis. It is an acute unilateral peripheral lower motor neuron facial nerve paralysis that gradually resolves over time in 80 to 90% of cases. So to sum up everything, always remember that Bell's palsy is an acute lower motor neuron facial nerve paralysis. Bell's palsy involves paralysis of the facial nerve or the cranial nerve number 7. The nucleus of the facial nerve lies within the reticular formation of the pons adjacent to the fourth ventricle. The facial nerve roots include the fibers from the motor, solitary, and salivatory nuclei. The preganglionic parasympathetic fibers that originate from the salivatory nucleus join the fibers from the nucleus solitarius to form the nervus intermedius. The facial nerve passes through the stylomastoid foramen in the skull and terminates into the zygomatic, buccal, mandibular, and cervical branches. These nerves serve the muscles of the facial expression, which includes the frontalis, orbicularis oculi, orbicularis oris, buccinator, and platysmal muscles. Other muscles innervated by the facial nerve includes the stapedius, stylohyoid, posterior belly of the digastric, occipitalis, anterior and posterior auricular muscles. So we can associate the cranial nerve 7 or the facial nerve to an electrical flow. So when electricity travels through the wires of our appliances or even our bulbs at home, it transmits energy in order to make the appliances or the bulb function and have lighting at our home. Just like the facial nerve, it supplies the different muscles of the face in order for it to function.
Bell's palsy is thought to result from compression of the 7th cranial nerve at the geniculate ganglion. The first portion of the facial canal, the labyrinthine segment, is the narrowest, and it is here that most cases of compression occur. Due to the narrow opening of the facial canal, inflammation causes compression and ischemia of the nerve. The most common finding is unilateral facial weakness that includes the muscles of the forehead.
Patients frequently feel discomfort in or around the ear near the mastoid process, cervical pain, and face numbness with no sensory loss before developing facial paralysis. Within 24 hours of these symptoms, the following occur with varying extent depending on the degree of facial nerve involvement and lesion location. The symptoms includes progressive loss of motor control on one side of the face over 1 to 10 days, loss of facial asymmetry at rest and with facial expressions, nasal alar collapse, nasolabial flattening, loss of taste on the anterior two-thirds of the tongue, slowed or absent blink reflex, hyperachoasis, excess or reduced salivation, excess or reduced tearing, facial muscle synkinesis, and facial spasms. And last would be referred pain around the ear and neck.
As to the differential diagnosis, these following conditions were listed due to its similarities to the signs and symptoms of Bell's palsy. But to differentiate, Bell's palsy usually shows unilateral facial muscle weakness, which can be clearly seen, and the additional signs are drooping on one side of the face, which includes the mouth, eye, and increased or reduced salivation and loss of motor control. Although the following conditions are same as the Bell's palsy, it will be tricky sometimes to identify the condition. It will be relevant to assess the wrinkling of the forehead if present on the affected side, need to ensure the facial muscle weakness in unilateral and not central, and assess for other cranial nerve deficit or long tract signs because brainstem fascicular lesions of the seventh nerve can show peripheral facial pattern of weakness. For the parotid gland tumor, it came from radiation exposure linked to the development of parotid gland carcinomas, especially on head and neck squamous cell carcinoma, that are linked to cigarette smoking and alcohol consumption, and skin cancers in the head and neck have been reported to spread to the parotids. Signs and symptoms are lump or swelling on near or your jaw in your neck or mouth, numbness in part of your face, muscle weakness on the side of the face, persistent pain in the salivary gland, difficulty swallowing, and trouble opening your mouth widely. Human immunodeficiency virus, or also known as HIV, is spread through sexual contact, shared needles, blood transfusions, and mother-to-child transmissions during pregnancy, delivery, and breastfeeding. Greatest incidence in men who have sex with men or MSM and minority populations. Signs and symptoms are fever, headache, muscle aches and joint pain, rash, sore throat or painful mouth sores, swollen lymph glands mainly on the neck, diarrhea, cough, weight loss, and night sweats. Ramsay-Hunt syndrome is the reactivation of dormant infection with varicella zoster virus after primary varicella. Predominant sex is equal sex distribution, and predominant age is increasingly common with advancing age, which is rare in childhood. Signs and symptoms are ear pain, hearing loss, ringing in your ear or tinnitus, difficulty closing one eye, vertigo, loss of taste, dry mouth, and eyes. Next is temporal bone fracture are caused by a significant lateral force to the cranium. Some of its causes are from vehicular accident and head injuries. The signs and symptoms are bleeding from the ear, severe hearing loss, bleeding behind the eardrum, bruising behind the ear, vertigo, clear fluid draining from the ear or nose, and balance problems. Next is Melchior-Rosenfeld syndrome, which is idiopathic. While the actual frequency is unknown, one study estimated its incidence at 0.08% of the general population, usually in young adult life, and have an average onset of about 32 years. Signs and symptoms are orofacial swelling, fissured tongue, and facial paralysis. Lastly, brainstem infarction or stroke is the most prevalent causes that includes atherosclerosis, thromboembolism, lipohyalinosis, tumors, arterial dissection, and trauma. The brainstem accounts for 10% to 15% of all strokes in males and is between 23.3 to 26%. In females, the risk is between 23.7 and 26.5%. Signs and symptoms are double vision, slurred speech, decreased consciousness.
such as irreversible damage to your facial nerve, abnormal regrowth of nerve fibers, and partial or complete blindness of the eye that won't close due to excessive dryness and scratching of clear protective covering of the eye.
There's no specific test for Bell's palsy. Your doctor will look at your face and ask you to move your facial muscles by closing your eyes, lifting your brow, showing your teeth, and frowning, among other movements. Electromyography, or EMG, this test can confirm the presence of nerve damage and determine its severity. An EMG measures the electrical activity of a muscle in response to stimulation and the nature and the speed of the conduction of electrical impulses along a nerve. Imaging scans, magnetic resonance imaging or MRI, or computerized tomography or CT scan may be needed on occasion to rule out other possible sources of pressure on the facial nerve, such as a tumor or skull fracture.
Did you know that facial motor study may be performed at 10 days and compared to the contralateral side? A motor response that is 10% the amplitude of the unaffected side has been defined as a critical value in one study in which recovery was poor when associated with 90% degeneration. Next, Bell's palsy are usually temporary. Even severe cases of Bell's palsy can be recovered, or some show improvement with the use of physical therapy treatment, such as electrical stimulation, thermotherapy, and facial exercises, wherein 71% of patients had complete recovery, 85% show recovery at 3 weeks, 13% had slight sequelae, 16% had residual weakness, synkinesis, or contracture. Prognosis is favorable if recovery is seen within the first 3 weeks. Recurrence rate is 7%, with an average time of recurrence was 10 years. Bell's palsy can cause imprecise articulation, but vocal quality and prosody is unimpaired.
Facial nerve decompression on surgery to decompress the facial nerve is controversial. Patients with a poor prognosis, identified by facial nerve testing or persistent paralysis, appear to benefit the most from surgical intervention. However, studies have been mixed as far as benefit from surgery. Surgery may be considered in patients with complete Bell palsy that has not responded to medical therapy and with a greater than 90% axonal degeneration as shown on facial nerve EMG within 3 weeks of the onset of paralysis. The problem must be localized with MRI. The surgeon can then decide if the maxillary segment should be decompressed externally or if the labyrinthine segment and geniculate ganglion should be decompressed with a middle fossa craniotomy. Corticosteroids such as prednisone are powerful anti-inflammatory agents. If they can reduce the swelling of the facial nerve, it will fit more comfortably within the bony corridor that surrounds it. Corticosteroids may work best if they're started within several days of when your symptoms started. The 2012 guidelines from the AAN state that steroids are highly likely to be effective and increase the likelihood of recovery of facial nerve function in new-onset Bell's palsy. Guidelines from the American Academy of Otolaryngology, Head and Neck Surgery Foundation were issued in November 2013 that also support the AAN guidelines. The guidelines recommend use of corticosteroids within 72 hours from the onset of symptoms. Evaluation of the use of antiviral medicines in Bell's palsy has shown limited benefit from these drugs, with 3 randomized controlled trials having demonstrated no benefit from them. However, given the evidence suggesting that a large percentage of Bell's palsy cases may result from a viral infection, the use of antiviral agents may be reasonable in certain situations.
So to sum up everything, Bell's palsy is an unexplained episode of facial muscle weakness or paralysis that results from damage to the facial nerve, which then presents pain and discomfort on one side of the face or head. It is caused by an adverse event of immunization, reactivation of herpes simplex virus type 1, and upper respiratory tract infection. Bell's palsy can occur to any gender, but risk factors include pregnancy, preeclampsia, obesity, hypertension, diabetes, and upper respiratory ailments. Patients with Bell's palsy would present signs and symptoms such as poor eyelid closure, blurred vision, loss of taste, facial drooping, drooling, pain around the jaw or in or behind your ear on the affected side, facial weakness, and numbness. You can assess Bell's palsy through electromyography and imaging scans, such as MRI or CT scan. Lastly, Bell's palsy can be treated through PT interventions such as electrical stimulation, facial massage, thermotherapy, and biofeedbacking depending on its severity. That's it, class. Hope you
Learn about
Bell's
Bell's
palsy.
palsy.